You might have heard that liver disease can mess with your hormones. Is it true or a myth? Well, the answer to that is it absolutely can. The liver plays a key role in hormone regulation. So when it's not functioning properly, it can throw your hormonal balance off. But how does the liver normally interact with hormones, you may ask? First, to answer that, we have to establish that the liver is crucial for metabolizing and regulating various hormones in your body. It helps break down and remove excess hormones like estrogen and testosterone, and also produces certain proteins that help regulate hormone levels. And that's not all. In addition, the liver is involved in the synthesis of proteins that bind hormones, making them more or less active as needed. When the liver is diseased, its ability to break down and regulate hormones is impaired. For instance, in conditions like cirrhosis, the liver's ability to metabolize estrogen decreases. So now you have excess estrogen. This leads to higher levels of it in the bloodstream. And what does an excess of estrogen do? This is important because high levels of estrogen can cause several issues. Elevated estrogen levels can cause gynecomastia, also known as breast enlargement, testicular atrophy, and impotence or erectile dysfunction too. Also, the reduced testosterone levels can lead to muscle loss, fatigue, and mood changes. Now, women might experience menstrual irregularities, but both men and women can develop spider angiomas, which are small, spider-like blood vessels that appear just under the skin. What about other hormones? Don't worry, we got you covered. Liver disease can also affect cortisol. Yup, that famous stress hormone that we blame all our weight gain on. We can debate that in another video. So normally the liver helps metabolize cortisol, ensuring that its levels remain balanced. But what if your liver is impaired? Yes, cortisol levels can become unbalanced, and this can lead to symptoms like increased stress, anxiety, fatigue, and issues with blood sugar regulation. Insulin is another significant one. You might already know that the liver plays a major role in glucose metabolism. It stores glucose as glycogen and releases it slowly when the body needs energy. Now, in liver disease, this regulation can be disrupted, leading to insulin resistance. This means your body's cells become less responsive to insulin, causing higher blood sugar levels in the blood, thus contributing to the development of type 2 diabetes. But are there any other hormonal effects you should watch out for? The answer is yes. Did you know that the thyroid hormones can also be affected? This extraordinary organ helps convert thyroxine, T4, to the more active triiodothyronine, T3. If the liver isn't functioning well, this hormone activation and conversion can be impaired. And with time, this can lead to symptoms of low levels of thyroxine, also known as hypothyroidism, manifesting as fatigue, weight gain, and cold intolerance. All this highlights how important liver health really is. Undoubtedly, keeping your liver healthy is crucial for maintaining overall hormonal balance and well-being. Eating a balanced diet, avoiding excessive alcohol, maintaining a healthy weight, exercising regularly, and getting regular checkups can all help keep your liver and your hormones in check. Let us know in the comments if you've had your liver function tested or if you are planning to get it done. It's good to get a baseline done to know where you stand. And this brings us to an important question. Are there any specific foods or supplements that can help? Here's our bonus for today because we want to give you the maximum value. So the answer is yes. Try to increase your intake of foods rich in antioxidants, such as fruits and vegetables, to help protect the liver. Foods like garlic, turmeric, and green tea have liver protective properties. You can even take these as supplements. Additionally, avoiding excessive alcohol, processed foods, and sugary drinks can reduce the strain on your liver. As always, consult with a healthcare provider before starting any new supplements, as they can provide personalized advice based on your health status. I'm glad you're here because your liver is vital to your overall health, so it's great that you're taking an interest in how to protect it. If you have any more questions, feel free to ask.